You're with the sound of ideas from Ideastream Public Media. I'm Jenny Hamill. Thanks for staying with us. Infant mortality rates in Northeast Ohio are 3 to 5 times higher for black babies than white babies. Those trends are an issue across the country, but are particularly prevalent in this part of the state. Experts at Kent State have found through their research that untreated post-traumatic stress disorder and chronic stress among black mothers play a critical role in high mortality rates among black children. That research led Dr. Angela Neal-Barnett, a professor in Kent State's Department of Psychological Sciences, to develop and launch the Spirit of Motherhood program back in 2021. Last month, Angela Neal-Barnett and Diane Robinson, immediate past president of the Greater Stark County Urban League, spoke about the Spirit of Motherhood program at Bell Tower Brewing in Kent for the latest installment of their Brains on Tap series. Here are Dr. Barnett and Diane Robinson.
When my daughter went away to college, Diane asked me what I was going to do with my time. I told you that I was going to sit on my deck, drink Moscato, and golf. And I was well on my way to executing that plan when a young woman knocked on my office door. "Everybody told me I should come see you," she said. "I'm a founder of a black doula agency, and the researchers tell us that these women have little stress and anxiety. But when they talk to us, they sound highly stressed and anxious. We think the researchers are wrong. Can you help us?" So I thought about it. And I calculated in my tea time, multiplied that by 2, and said, yes. How much time could it take? 3 months tops, I thought. 8 years have passed.
My gosh, 20 minutes.
Haven't seen the deck. Moscato's in the fridge. And I'm fairly certain the golf bag is missing. What isn't missing, however, is the importance of perinatal mental health in perinatal health and understanding the role that that plays in maternal morbidity and infant mortality. Didn't take us very long to figure out what was going on. The researchers were finding what they were finding because they didn't take the time to listen to black women. So we decided we were going to listen to them, and we developed Sisters Offering Support Sister Circles, an intervention for stress and anxiety among black pregnant women, where we listen to the women and they listened to each other. And what we found was that when it came to mental health, the women just didn't know. And time again, we heard, "What? You mean this has a name?" We just thought it was the way it was supposed to be. And it turned out that while we were listening, people were listening to us. And so I was approached by the Sisters of Charity to do a grant with pregnant black women in another area of Cleveland. So this time, I didn't even consider the tea time. But what I did consider was the fact that black babies were dying. And when they did, their mothers were left powerless, and that the Prada team had knowledge and we had skills to reverse that trend. And so I said yes. I knew, because I knew the neighborhood we were going into, that I needed someone as dedicated to the community as I was, who would not blink going into an area where angels feared to tread. who knew that if we were going to make a difference in maternal morbidity and infant mortality, we had to work in the places where the women who were at risk were, regardless of where that was. And so I called Diane.
When Dr. Angela called and asked me to work with her on a grant-funded research project regarding the trauma and the problems that Black mothers was having, I was intrigued and wanted to hear more. After some discussion, I came to an understanding and knew that there was very little, if any, research regarding stress, anxiety, and trauma with regard to Black mothers. With that, I immediately accepted the offer of project coordinator. Within my being, I knew that this research would be a crucial step to identifying the causes of stress and anxiety among Black mothers. I knew this too could help determine the accuracy of the information that was there with regard to the low stress and the anxiety that they were reporting for Black women. We immediately also considered the fact that it would give us an opportunity to evaluate and reports that the doulas who were working with these mothers was hearing and reporting back to us. And so it was an easy decision for us to move forward. Now, the funding was there. As you heard Dr. Angela say, Sisters of Charity had approved and approached Dr. Angela, asking her if she would investigate and determine how to best support the needs of these Black women. To begin the research, we worked with doulas from Birthing Beautiful Communities. We worked with them to recruit Black mothers living in the central neighborhoods of Cleveland. We wanted them to participate in the focus group programs and to ensure that we had the number of moms that we needed to conduct meaningful focus groups. We provided incentives. We gave them gift cards. We provided food and transportation and a person to care for their children while they were there at the focus groups. And this was on-site care. And of course, we provided food, toys, coloring books, and all these things for the children. And that was to free the moms so that they would be invested in the focus group and they would share the much needed information so that we could develop programs, interventions that would make a difference for them. It was after the focus group sessions that the PRADA team discussed the collected information. And that information was really heartwarming. It was elegantly provided to us, and we knew that we would be able to use that. The focus groups came together, and the PRADA team discussed the collected information, and they asked the Urban Ounce of Prevention, a group of counselors, to code the recorded information and review so that we would not just think that we as the PRADA team had heard the information, but they confirmed it. The Urban Ounce of Prevention, a group of counselors, coded the information that we received from the focus groups. When we received their report, it confirmed that our original consensus about anxiety and stress was true. But what really stood out was the trauma not only the trauma that spoke about through their eloquent sharing with us, but the trauma and the cortisol said that was in their bodies. So with this cortisol testing of the trauma, it was really exceptionally high. Little did I know that 5 years later and 5 grants later, I would still be working with this very important project, invested in the work.
And I didn't either. When I made the phone call, I thought, okay, this is just temporary, and until I get a postdoc. Yeah, well, anyway, enough said about that. The psychosocial data was really enlightening, but it was the cortisol data paired with the psychosocial data that was just absolutely compelling. So cortisol is the stress hormone, and cortisol behaves a lot like I did when my daughter turned 16. I threw her the keys to the SUV, and I went down to the dealership and I bought myself a grown woman's car. Now, for those of you who don't know what a grown woman's car is, it only holds grown-ass people. No toys, no dance bags, no instruments, no kids allowed at all. Okay. I wheeled that baby off the lot, jumped on 77 going south, and I drove 77 miles per hour for 77 miles. At the 78th mile, the car started making noise. At the 79th mile, steam rose from the engine. And at the 80th mile, the car just stopped. It would go no further. And that same thing that happened to my grown woman's car is what happens to black pregnant women, okay? The stressors of interpersonal, systemic, and internalized racism, coupled with the everyday racial microaggressions, shoots up the cortisol. They run like my car, hot, but you can only run hot for so long, and then it just dies. The cortisol becomes what psychologists call blunted. And blunted cortisol places you at risk for anxiety and for PTSD, post-traumatic stress disorder. High cortisol places you at risk for depression. And so as we looked at this data and considered our options and considered the cost to these women, their unborn children, and their families, psychologically and physically, the spirit of motherhood was born. The spirit of motherhood is a 3-component intervention. The first component is an individual treatment for PTSD called WET, which stands for Written Exposure Therapy. The second component is a parenting skills sister circle, 5 sessions as well. And the third component is a music intervention. And then I thought we were done, but what happened?
They asked for more.
They did. So we developed an infant parenting sister circle. Again, 5 sessions. The entire program is delivered in the community by doulas, community health workers, community folks, undergraduate, graduate students, and us, all of whom, and our entire team, is primarily or mostly Black and biracial. I am not a parenting research expert, so I thought it would be better to bring in a parenting expert to collaborate with our community experts. But in doing so, I failed to listen to the voices of the Black mothers who continue to tell us that if they had had any mental health intervention, it had only been for one session because the therapist didn't look like them, didn't appear to be listening to them, and they were fearful that they were plotting to take their children. When I brought in the parenting expert, though, I forgot all those things. And these old fears and feelings resurfaced with our team. Well, Diane, what would you say?
It didn't work. What we learned was that the moms were much more trusting of our Prada team, and they didn't want to work with anyone else. As someone who has always worked in the community and for the community, I understood there were aspects of collaboration that were taken for granted. You see, our Prada team understood the importance of building the relationship with the moms they were working with. With this trust, there was a dedication to including good feedback. And that feedback came from all of the diverse people that made up the team for Prada. And it really built the relationship so that the moms would trust, and they did this by consistently tailoring the interventions that we had based upon what the moms said they needed. It was also important to understand that the community we were working within communicated their hardships through stories. And what we needed our team to do was to listen to the stories within the lives of the Black women. We found the keys to the components of the spirit of motherhood by storytelling, and with us listening to the individuals, we then utilized that information. Storytelling then became a very critical component to our parenting classes, and when developing the Parenting Sister Circle curriculum, we collaborated with a videographer, media consultant, and musicians who produced video series on topics such as reaching out for help, the importance of knowing how to change a diaper, safe sleep, managing stress, and managing conflict using music and role play scenarios. The music continued the stories and was therapy for the children that took part.
We were so proud of what we had done. The program was excellent, and the mothers confirmed that. But unlike the Field of Dreams, just because you build it doesn't mean they will come. There has to be order and symmetry and purpose to what you do, and it must be disseminated consistently within the communities. So we are never in the office. We are always in the communities, at community events, and we're embedded in your stomping grounds, the urban leagues of Northeast Ohio, working with the underserved. And the spirit of motherhood has been successful. That's not just me talking or Diane talking. The data shows it. We've reduced PTSD symptoms by 50 to 100%. And we've seen those gains. Well, thank you. And we've seen those gains in 3-month and 6-month follow-ups. We've reduced parenting stress by 25%. And more importantly, we've listened to Black women. They trust us. They trust us to the point that they ask for more ways to be involved in their mental health. But more importantly, we've learned to trust them. Yes. And I think that's the real beauty of partnering with the community and working together as experts. As a mother, I want more for my child than I had for myself. That's the same thing our Black mothers want. That, and to live to see their child's first birthday. And that the child live to see his or her first birthday. Because Northeast Ohio, and in fact, across America, that is not the case. Diane always says to me that the spirit of motherhood is more than an intervention. And on my good days, I think she's right. We've watched this program unfold, and it has impacted positively on the mothers, their babies, their preschoolers, their families, their communities, and even policy. More importantly, I think, Diane, that we've witnessed hope, which psychologists tell us is the key to healing. When the mother enters the spirit of motherhood, she comes with the hope that maybe something different will occur. Maybe this time it'll work. And when she leaves the program, she leaves knowing that hope never, ever disappoints.
That was Dr. Angela Neal-Barnett and Diane Robinson speaking about the creation of their Spirit of Motherhood program aimed at improving the health outcomes from Black mothers and their children. It was part of the Brains on Tap lecture series that happens quarterly at Bell Tower Brewery in Kent.